Hello, my name is Ben Weber, and I'll be presenting mine and my colleagues, Dr. Blitzer, Dr. Anderson, and Dr. Schuster's work, the analysis of patient contacts with a radiation oncology triage nurse. As many of you know, nurse triage is an important component of patient care across a spectrum of specialties and has been well studied, most notably in the fields of urgent care and emergency medicine. The role of nurse triage in radiation oncology, however, has not been well studied, and therefore there may be significant differences in how nurse triage is implemented across institutions. In our study, we analyzed and thematically coded phone calls and EMR messages that were directed to nurse triage between September 1st, 2021 and November 31st, 2021. As appropriate, secondary and tertiary themes were noted, and the author of the message was also recorded, that is either the patient or a caregiver, such as a spouse or adult child. In our analysis, there were 13 distinct message themes that we uncovered. For both phone calls and EMR messages, scheduling was the most common theme. For phone calls, medication refills and treatment-related side effects were runners-up. And for EMR messages, questions about treatment decision-making and questions about test results were the second and third most common message themes. Some examples of scheduling messages for phone calls were things such as, quote, patient called and wants to know when he will be scheduled for his seed implant, unquote, or, quote, patient's wife called to schedule an EKG, unquote. For EMR messages, there were similar questions such as, quote, do we have an idea of which week radiation will start, unquote, and, quote, my PET scan was canceled, can we reschedule for an earlier date, unquote. Other types of messages for phone calls included things like treatment-related side effects, which are things that you may expect, such as patient continues to have weakness and fatigue, or things that are a little bit more nebulous, such as patient is having, quote, bathroom problems, unquote. For EMR messages, treatment decision-making was one of the runners-up. These included things like, my CT scan had uncovered several nodules in my lungs. This sounds serious. I write to ask about the next steps and presume to move quickly as possible to diagnose and treat. In addition to the message themes, we also recorded two special characteristics of messages. These include things that were not initiated by the patient. Those would be messages from caregivers, and then also whether or not they had multiple themes. As for not initiated by patient, phone calls tended to have more of those, while EMR messages tended to have multiple themes. Our analysis reveals the nature of patient concerns being routed to the nurse triage line at one radiation oncology clinic. And scheduling was by far the most common theme for both phone and EMR messages, but the content within categories was varied. For example, patients may have been inquiring about scheduling or rescheduling an appointment with a physician or about scheduling other diagnostic tests such as CT or EKG. About 30% and 10% of phone calls and EMR messages respectively came from patient caregivers, which highlights the need of the importance of family communication. Through our study, we identified several areas that may be targeted for future intervention, and we may focus on leveraging patient supports and providing information to their caregivers based on our results. And here are some references. I look forward to getting any questions from you in person at the conference this week.